Assalamu alaikum. Hello, everyone. We thank all partners and sponsors in Attliq Program. Special thanks to Sadaya, Ministry of Communication Information Technology, Majid Society, Ernst & Young, KAU University, Sitco Holding, and Nisma Holding. We would like to give you a small brief about Attliq Program. Basically, Attliq Program helps early stage entrepreneurs in formulating their ideas and developing their first MVP to test the market. So this Attliq Program started for its second edition in 2021. We had a good success in first edition during COVID-19. It was the start of helping early stage entrepreneurs with no code and no stack tools and developing their first MVPs in place. We would like to introduce panelists and moderators in this session. Our session is regarding healthcare tech. So we'd like to introduce Dr. Abdul Qadir AI Solution Consultant from Sadaya. We would like to introduce Mr. Abdur Rehman and Assistant General Director for Digital Technologies, Saudi Health Council. We would like to introduce Mr. Abdul Hakeem, Deputy CEO of National Strategy for Data and AI in Sadaya. And special thanks to our moderator, Mr. Mohammad Sear, Digital Government and Public Sector Consultant Leader in Ernst & Young. Hello, Mr. Mohammad.
Hi, Bahar. Great to be here. Thank you very much for making the introductions. And we're here today really to have a chat, discussion, and keep it as informal as possible so that whoever is attending this can take some value from that. Before going to my panel members and asking their opinion on various topics, just to set the scene, we are talking about a subject, healthcare, which is important to all of us. It personally touches us and our families and our loved ones, our friends. And the second thing is that COVID has really put a spotlight on the importance of the sector. And it's also accelerated the use and adoption of digital technologies across the entire value chain of healthcare. Particularly, we've seen the use of digital technologies by the healthcare professionals double during the COVID period. And many of the patients or users of services using digital technologies as well. So we know that digital is playing a pivotal role and can play a pivotal role going forward. The question we are trying to address today is, what's the future of healthcare? Or is digital the future of healthcare, and how digital technologies will enable better outcomes for all of us, and how the startup ecosystem is going to play a role in this, or do they have a role to play? And what can our organizations in government like Sadaya and the Saudi Council for Health and other organizations play a role? So let me start with Abdul Qadir, if you don't mind, with you. You're working with Sadaya and you focus on a very interesting technology, which is AI, and is well, everyone's saying it's going to change the way we all live our lives. So I'd like you to talk about a bit, what is it that Sadaya is doing in terms of healthcare and AI, and how you are supporting entrepreneurs of the future.
Thank you, Mohammed. I think you stated it very well, that with the current COVID-19, the whole health ecosystem being tested and unfortunately failed to co-op with such a pandemic. And we cannot continue doing the same thing and expecting different results. Accordingly, the AI is the technology will be disrupting the industry, and healthcare is one of those industries being, let's say, with the status quo for a long period of time. To make it more efficient, AI is playing a major role to shift and transform such industry. And today, and I will leave some of the discussion related to the national data and AI strategy for Abdul Hakeem to talk about it. But in health, we are playing the enabler of the ecosystem by building a collaboration model to connect between the demand and supply. And this is what Sadaya and Insight focusing on, where we bridge a gap today happening between who can provide the solution leveraging in AI and data, and the consumer, who is the healthcare provider and the whole ecosystem working with the regulators.
Thank you for that. That's really great. If I can turn to you, Abdur Rehman, and I want to put a question to you, because the Saudi Health Council is obviously a very important player in the whole healthcare ecosystem within Saudi Arabia. And I know that you are working in collaboration with many organizations in Saudi Arabia to improve outcomes for all of us, when it comes to healthcare. In particular, with Sadaya, you are jointly and collaborating, trying to solve this big problem of healthcare. Can you talk a little bit about how your collaboration is going on today and what kind of things you are working on?
Sure. The first thing that we did when the NASI created, we met with them, and actually they met also with us to discuss the national strategy for AI for healthcare. And we will collaborate together to create an ecosystem for everybody. The Saudi Health Council is responsible for the whole health sector in the country, not only a specific sector like Minister of Health, only responsible for the hospital under Minister of Health. And one of the things that we're doing is that we have a national lab for emerging technology. This lab, the purpose of it is how to create or how to use the, emerging technology like AI or blockchain or AR or virtual reality to improve healthcare through entrepreneurs. If they have an idea, they can come to the national lab and they can discuss it. After that, they will create a POC that will be tested within within a health organization. And after that, they can look for an investor to invest in or launch their application.
Great. And turning to yourself, Abdul Hakeem, you are sitting in a very important organization and with a tremendous responsibility for the future shaping of the AI story in Saudi Arabia. We'd love to hear a bit about the national strategy, what's focused, and really what will be the outcomes we can achieve going forward over the next 5 to 10 years.
Sure. So the strategy was announced last year, and the strategy takes care of all the data and artificial intelligence agenda within the kingdom. And from the government perspective, this means different things. One would be the education and the skilling needed to upskill the workforce, and also make sure that the education sector is addressing the education needs in data and AI. And then there's the regulation part, which we also take care of. And this is mostly related to the data part today. So this is related to freedom of information and data sharing and etc. Tomorrow, we would anticipate to see the AI part starting probably with the ethics part. And then there's also the investment, where the government is also initiating investments or also encouraging investments in the private sector as well. We also touch base on the research and development, and this is what our colleagues at National Center for Artificial Intelligence are taking care of. And lastly, we look also at the ecosystem for artificial intelligence, starting from early stage startups to large companies and organizations.
Great. So as you were the last person to be asking the question, I'm going to give the opportunity for you to be now the first person. And just to follow on the last point you made, which is this ecosystem. Data is obviously the new oil, or many people are talking data as being the new oil and the engine for the economic growth of many countries. And Saudi Arabia is no different. It is looking at how data can really enable a different economy, and the digital economy being the spotlight of this. Can you go a bit more detail in the startup side of things? How is it that through either an open data strategy or other initiatives you will be launching, that a startup can see an opportunity for them to participate in this going forward?
Well, first of all, let me just give you from a government perspective in general. I think there are a lot of great things happening when it comes to early stage startups. We've sit with a lot of different people from different organizations, whether it's PIF or other government entities, Munsha'at, etc. I think there is a lot of potential for early stage startups. And we see a lot of investment and drive either from the government through the Public Investment Fund, for example, or from the private sector. And I think this is mainly because of the multiple unicorns that we have seen in the region. I think this has, sparked the interest of a lot of different people, whether it's investors or early stage founders. So I think there is a lot of potential for startups in general in the kingdom. Now, when it comes to Sadaya and what it does, we have come up with multiple initiatives related to this. So one is the new accelerator program that we're looking to launch soon. This would address the stage startups mainly in the field of data and artificial intelligence, with the focus on different sectors. Definitely one of the priority sectors of these is healthcare, for sure. In addition to this, we have also been exploring how to actually ensure that the data that we have at the government are properly utilized. So we are trying to assess what kind of initiatives that we can come up with today that would make use and leverage these data sets at the government. And this would be most likely through a potential sandbox initiative that we're looking to initiate that would leverage the data side and also explore the regulatory, let's say, limits that we have today. These are just two initiatives that we have today, and we believe that we would try to be closer to the ecosystem of startups, so that we can come up with more and more initiatives that would suit their needs and flourish the ecosystem and throw mostly, let's say, through the seeds for such startups.
Great. And turning to yourself, Abdur Rehman, when we look at the whole value chain of healthcare, where do you see the most opportunity for young entrepreneurs or innovators? If they were to think that they're thinking about creating solutions, digital solutions for the healthcare system, where do you see the most need in Saudi Arabia?
From what happened in COVID, most of the thing that people need is a service from afar. An equality of service to anything, except like for chronic diseases patient, when the hospital shut down, everything got shut down. A lot of people they did not get their medicine, did not get their actual health visit, and also for triaging. That I don't know, am I having COVID or am I having only a normal flu? So for entrepreneurs, anything that can serve the public, using either an AI solution or NLP solution to help with either answering questions or even advising them to go in which area. Also, the telemedicine application, it got very effective. And also for what we are lacking right now, we have some other entities that are doing it right now. It's medication pickup. That instead of me going to the pharmacy, I will ask a person to go and pick up my medication. Right now, some of the hospitals, they're doing it through a phone call. They will call you, they will tell you that you have a medication pickup, can you come and get it? If there is a service that will come, and for chronic disease like myself, I have diabetes, they will come to my house, they will draw blood, then they will do the normal checkup, and all of this done through one application. I don't have to go to one application that will do my blood. Then after that, I will get the result. Then I will get the medication written by my doctor. An equality of application. What we are seeing right now, and this is actually what making the citizen happy, is the Wakana application. Is taking all of the applications in the country and putting it into one place for the people to be served. Now even they're talking about adding online payment. So instead of me going, if I want to pay a service, going to the bank or online banking, then I will pay it, then I will go back to the platform and it said that, yes, you paid it. Why can't I do it from one place? So as long as you can create a service that has an edge that will create a service for all in one place, this is the next thing that the people will be waiting for. Traditional application like just monitoring your health or monitoring your heart rate or your diabetes, there are tons of these applications, and you have to have a very advanced technologies just to use something like that.
So what I'm hearing is that where there is a business model evolution connected with technology evolution is where we see the value of the future coming from, not just looking at some of the current business models and using technology for that. If I can move to yourself, Abdul Qadir, any use cases have you seen where, particularly when it comes to interoperability, which is a big challenge when it comes to if we're looking from a citizen perspective, one of the challenges is always about my information about healthcare. And many governments around the world, including Saudi Arabia, has tried to look at a way of creating this electronic medical record system that is able to speak to many different systems. Have you seen any advancement or any use cases where AI is playing a role, or there are some very unique solutions which are trying to solve this interoperability problem?
Absolutely. And if you just allow me, just maybe touch base in the economic value, because I think this is a great opportunity for startup to think of. Today, we're saying we're spending almost 6% of our GDP in the healthcare. And the burden of chronic diseases like diabetes, where we spend on a yearly basis with the complication more than 15 billion Saudi riyal. And we're expecting to double that by 2030. And there are a lot of opportunity where we can address the quality of life and the life expectancy, addressing the strategic objective of the Vision 2030, where solution can touch base on the access to service, touch base on improving the quality, reducing the cost, as well as shifting the model of care toward prevention. Now, technology is evolving with a lot of RPAs that support when it comes to improving the quality of data, enhancing the interoperability of different systems talking to each other. The methodology and the technique today, leveraging many of natural language processing, is enhancing big time to increase where we can exchange data in a manner where it's produce value. In today's market, and just giving a very conservative number, we are expecting a market size around 5 billion Saudi riyal from the health data. That's only for secondary use, without touch base on the actual primary use of the data, which introduced to be promoting saving a lot on the budget expenditure from a government point of view. And that's with the compound growth rate around 18 to 20% for the coming 10 years. So we're talking about a market size around 400 billion within 10 years. That's only coming from health data. And I think this is where a lot of opportunities. Now we lay down across different priority diseases what is going to be the priority use cases. And we have almost 15 national priority use cases that we today identify and working out with the whole ecosystem. Some of them will be worked out through Insight, and some of this will be throwing to the open innovation model where entrepreneur and startup can contribute to that journey.
Great. Let me bring in Bahar yourself about the private sector. Just if there's any use case or use cases you can share, and particularly in your program that started last year, did you find any interesting entrepreneurs, innovators who came into the program that are focused on healthcare, and if possible, looking at AI as a technology to use?
This is a very interesting question, Mr. Mohammad Sear, and thank you for addressing that type of questions. Well, I'm going to address that from our perspective, from operator perspective in the field of running entrepreneurial programs. First of all, when we started, the deal flow was different. We haven't seen much of early stage innovation in terms of healthcare or in terms of education. However, in the last 2 years, due to COVID-19, we've seen some of the entrepreneurs starting opportunistic models in that space. So not in our program, however, we have seen that private sector have started to leverage the use of technology today in the field of health solutions. So for example, one of the entities that we have spoken to, they have started to leverage the profile patient in terms of their attendance for certain appointments, and it shows you the part of the algorithm in AI that helps the hospital and customer experience, or sorry, patient experience, and being doesn't showing up in one of the appointment doesn't reflect in other customer experience. So we've seen an early stage, but these are mostly implemented by the healthcare itself rather than early stage startups. And as our expert has mentioned, we will see more innovation coming into space once we see the landscape starting into that field.
Great, thank you for sharing that. That's really useful to have. I mean, if I was to, Abdur Rahman, turn to you in terms of when I look at different areas of healthcare, one of the beginning parts is about how do we shift the mindset towards empowering us as citizens to live healthy lives. And we often hear the phrase that prevention is better than cure. Have you come across any interesting entrepreneurs or innovators who are trying to look at solving the prevention challenge? Because we have still seen government struggle with getting people to live a more healthy life, and prevention towards diabetes or other such diseases are possible to manage if we had a different lifestyle from the beginning. Be keen to hear your views on that.
Sure. Before COVID, there was an application, there was a campaign in Sahati application by the minister himself, His Excellency Dr. Tawfiq Rabi'a, to encourage people to walk. And there were rewards. If you increase more than 8,000 a step, you will get certain rewards on that area. But when COVID came, this initiative went a little bit behind. And as you can see with COVID right now, we need awareness to be a part of the life itself. People are going outside. Even right now, the number of COVID cases has been increasing, and Ramadan is in the doors, and everybody is scared because there's a lot of family gathering. Until now, from my point of view, I haven't seen an application that can introduce prevention, and only prevention come if there is fines. If like Google and Apple, which is the ultimate Pepsi and Cola of technologies, they did an innovation which is you can share data. I think if governments enabled that this application, if you came across, or if you, a lot of people, there were a rumor that Tawakkalna will see through your GPS location, and I know they don't, but I mean, this is what the rumors are, that if more than 20 people in the same location, they will find them. I'm with that. If there are multiple people at the same location, you have to not find them, but send an awareness to them through their mobile that you are setting multiple, you're setting 20 people or 30 people at the same place. People are not understanding that the COVID is, or the health lifestyle is an important thing to increase your life, to increase your quality of life. Right now, people in their 40s, they are either, they have heart attack, they have, they lose maybe one of their organs, or or for diabetes, they will lose a foot or a hand. If you show those stories to people, that this is the ultimate goal, or this is what you will have if you just increase your walking distance by 30 minutes, or you ate healthy, or you ate this or that. There was also an initiative by the Ministry of Health and Saudi FDA when they added the calories to the food. multiple people were shocked that a small, I don't know if you know it or not, it's called tamiz, which is a bread that round, and that has alone 1,800 calories. Many people were shocked, how? I'm eating this in the car while I'm going home to eat and eat another one. So those kind of thing of that you need to shock people that this is your future if you continue living this life. If there is an application or there is an AI, I heard there's something that it will take most information from people, and based on their lifestyle, this is what happened to them. And even for diabetes, because they change their life habit or lifestyle. I have diabetes, and the type 2 diabetes, they're saying it's a lifestyle diabetes. If you change your lifestyle, you will be better. You don't need even medication. But with COVID, everything got shut down because we didn't walk, we didn't do anything. And now my glucose fasting is 300. So that was a disaster. So now I'm trying to go back and try to see how can I live my life. If there is an application or there is an innovation that will tell people your sugar level without less invasive procedure, like if I take a blood, if you can take it through my sweat or through saliva or through something that I can use it in regular basis, I would know what am I eating right now that is increasing my sugar level.
That's great. And actually, you helped me with the next question with Abdul Hakeem. It's something that was going through my mind, and you kind of brought that to the forefront, which is, do we see a new business model evolving, which is in using AI as a way to be more preventative model of healthcare, where we're using more and more variables, and we have either through self-monitoring or through maybe a company level monitoring, an organization that provides a service is monitoring your vitals on a continuous basis and is being able to advise and inform you on how you are living your life, so that you can take more preventive actions in real time rather than once the problem happens. Are you aware of any of such initiatives or any interesting development programs or any even startups in this space?
Frankly, I don't know any of these companies per se, but I have seen a great development recently in the field of AI when it comes to digital health in general. I've seen a lot of startups, international startups, that can take some input from you on your health style and what you do throughout the day, and also does this diagnosis analysis on your health status as well, using definitely AI. I think these applications are on the rise today. Definitely, there is a lot of data that needs to be exchanged and shared in order to come up with the best models for such applications. But I anticipate that these applications will be part of our daily life in the future. And using, what we do every day, the data that we have every day, either, you enter it manually in these applications, or it can be, let's say, traced through different APIs in your data system, whether it's through your health usage or healthcare application usage, or through, let's say, let's say in exchange with, let's say, food delivery application. Whatever you order today can be consumed and analyzed and give you a result on how you stand in terms of your health.
So the next question to you as well, because it's connected in some way, and it all comes back to data. I mean, if we look at how can we maybe move towards a truly proactive and predictive model for healthcare, it is by monitoring, as you said, and seeing how we're leading our life, whether it's how much time are we spending working versus doing exercise versus what kind of things we eat, how is our sleep. All of these things are factors which will contribute towards a healthy or non-healthy lifestyle. But each of these data sets are sitting maybe and being collected by different organizations. You may have a restaurant who is having your history of what kind of food you deliver and eat. You have maybe a healthcare provider who you have interactions with, and they have some data. And then obviously you have other sets of data, your work related, and your maybe gym membership, how much time you're spending. Now, all of these are in different places, but somehow you need to look at leveraging all of this to build these kind of solutions of the future. What role do you see Sadaya potentially playing in making all of these sets of data, either collecting and making them available, or even facilitating somehow?
Sure. So if you ask me, and maybe also my colleague Dr. Abdul Qadir can elaborate more, but from my perspective, I would assume that there are three ways where we can help with this. So one would be when it comes to the regulation side. So the sharing of data and healthcare data specifically. This is a sensitive topic, so it is important to set the right regulatory framework for companies to feel free to exchange data with other companies or with individuals. That is one part. The second part is, I would assume, an aggregation of data. This would come in collaboration with the healthcare system in Saudi Arabia, where we can have these platforms that can actually receive these data sets and help the citizens with their data usage or understanding of their data status or of their health status. I mean, an example of this is Sahati today. An application where you can do some activities in there, but what else can we do under that umbrella? That is the second one. The third, I would assume, would be related to encouraging companies to actually be able to exchange data. So bring companies that are, encourage companies outside of Saudi Arabia to come to Saudi to initiate such activities, or encourage new startups in Saudi to work in this domain or field where we feel there is, let's say, a gap in there.
Great, thank you for that. I'll move to you, Abdul Qadir, please, if you can further maybe elaborate on and give your perspective on the same question.
Sure. So I think what Abdul Hakeem also stated, it's very important and crucial aspect where having a national regulatory framework to enable data exchange. But I think to the point where we will always talk about behavior, and changing behavior is not an easy task. And if we look today, even other industry like economy, now there is a big booming towards how the behavior economics is changing the consumers, how we purchase, how we do business, how we act. And it's similar concept with the health. So you cannot tailor a specific prevention program and expect that to work across the board in all your citizens or all the population. You have to come up with more personalized behavior specific solution that tailored, and AI is the engine would be able to personalize your plan to manage your behavior, where you can nudge people, you can play with the gamification, you can anchor people, you can do a lot of things where they can contribute and change in their behavior. Because to your point, we cannot depend only on the clinical data available in hospital. Eventually, you spend 5 minutes or 10 minutes 3 times a year, and you cannot just use this as the ultimate data decision making based on this couple of minutes you spend in a hospital or a visit. So the rest of the story is outside the port of the hospital. And I agree with you that a national and where a government entity like Sadaya would be working to build a framework to exchange the data when it comes to environmental data, social economic data, educational data, behavior data, lifestyle data. And then we're talking about the clinical data and this genomics data, and bridging all of those different data sets and different sources to build AI-powered program of excellence that support us where we will feel being empowered as individuals to lead our health.
Great. I want to, Bahar, bring you back in again with a question, which is around, I'm an entrepreneur interested in investing time in the building some kind of solution. And, one of the things that always hits entrepreneurs or innovators is either they don't have the right amount of support, funding support, or they don't have the right amount of access to tools and that they can use to experiment, because it can be very expensive to really at early stages. But one thing that can stop you in your tracks is when you feel there's a huge amount of regulation that, even if you have the money and have the tools and access to advice, the regulation will stop you from being successful. In your experience working with startups, what's the biggest thing that you have noticed that we may put on the table for our great colleagues over here who are working in government to have on top of their mind to enable a healthy startup ecosystem in healthcare?
Thank you, Mr. Mohammad Sear, for addressing these type of questions. To be honest, us being working with early stage startups and operating startups, funding, yes, it's a big issue. However, we do help them in using methods such as bootstrapping and so on and so forth. So for us, it's viable to guide and mentor those early stage startups into a business model that would generate revenue from an early stage. So this is one aspect that we make sure that we help our early stage entrepreneurs in addressing. When it comes to tools, I do agree that early stage tools for entrepreneurs to be used, it's a bit expensive. However, we see today a lot of entities that are coming in and providing these tools for a discounted period and a free period. So this is an element to be addressed in the tools that could be used by early stage entrepreneurs. When it comes to regulation, this is a very interesting topic. When it comes to AI and big data, as we've seen, there was no entity responsible for that. So thank you, Sadaya, for being here and addressing all the regulatory framework that will be in the future. When it comes today, we haven't seen a startup that want to get into the space. When it comes to data, well, let's separate it in two elements. So if an early stage startup found a champion private sector that would like to use the data and enable that, the private sector will open the door for them. However, it's very difficult for early stage entrepreneurs without a track record and a history to knock the door on one of the biggest universities, which they have a health center, or to knock the doors one of the ministries, which they have a health center. This is very difficult because there is no regulation when it comes to accessing those data yet. There is no way to commercialize it, so it's very difficult to give it to them. However, if they found a champion from the private sector, it's very possible to be addressed. When it comes to private sector, there is always different sizes. So if you are an early stage entrepreneur, don't go to world-class health hospital. Start with a small clinic in place that you can enable them with your solutions. Once you address a couple of those in place, then you can go to a medium-sized clinic. Once you achieve that, then you can go to a bigger clinic. And even when you go talk to investors, coming back to the funding, even when you go back to investors, well, going to investor with an idea is different than going to investor with a track record that you served several clinics, even if they were small, but you show a potential. So we do address that by telling those early stage entrepreneurs, look at the bigger picture. At the end, you want to serve these hospitals, but for you to start, you have to address small clinics, private clinics, one-man clinic, one doctor clinic. Then you serve a bigger clinic. Once you do that and you get the trust of the private sector, then you can knock doors on bigger entities in place. So I think entrepreneurs have to be realistic or to address their power. Their pitch depend on what they have addressed in capabilities before. So we advise early stage entrepreneurs to take it from a different perspective. Test your business model with smaller clinic. Once you achieve that, then you can go to bigger clinics and so on and so forth.
Thank you for that, Bahar. Much appreciated. Abdur Rehman, can I ask you a question from being, Saudi Health Council? obviously your whole organization is focused on the subject of healthcare in the kingdom. What's the biggest problem area that you would like to see entrepreneurs or innovators start focusing on in the whole ecosystem of healthcare? Is it primary, tertiary, second? Where do you see the biggest challenge for you?
From technology point of view, we want in the primary healthcare, because the primary healthcare will help a lot of people, and also the model of care that the country is, or the Minister of Health is implementing. Most of the, if you need to go to a hospital, that's mean that it's a serious problem. But if it's a normal or it's a chronic diseases or just a flu, you can go to the primary care, and those are the most number of people that will go there. If there is an application or there is something over there, it's like for rating the primary care facility, whether it's government or private. If I want to go to a doctor, or if I want to activate the family health physician, we don't have much of them in Saudi Arabia, but this is the point of the new model of care, that they will create a family physician that it will know all of the history. If my son or my daughter will go to the primary care, they would know everything about them, because they know their mother and their mother or grandmother, grandfather, all the information that were there. So from entrepreneur's point of view, we want somebody to mine this data or to analyze this huge amount of data that will come up from either primary healthcare or from the personal information. If you have an Apple Watch, you can I can measure a lot of things from the person. I can measure his or her sleeping habits, their also heart rate, and now in the new Apple Watch, you can test the echo of the patient, and it was approved in Saudi Arabia. Just one thing that you talked about, if what will motivate the entrepreneurs to work in Saudi Arabia or to happen. Today, under His Royal Highness Patronage, Prince Mohammed bin Salman, there will be an event for launching made in Saudi Arabia. And this will increase the chances for a lot of either hardware manufacturer or even application. As Mr. Abdul Hakeem said, that we have some unicorn that came from here, which is Kareem. We have other applications, and one day we will see health application that it will go through globally, and everybody will use it because of the model, and also the incentive that from people here in Saudi Arabia and even the government to help the entrepreneurs to get the data, as long as you can use this data for the good of the country, for the good of your application. They will help you to acquire this data, and also to teach to use it in your application, or to teach your AI. Right now in the Saudi Health Council, we are testing an application. I cannot say the name of the company, but to test the X-ray, to make sure that it will just help the doctor. That to say this X-ray has a tumor, look at it first. Don't look at the other X-rays. You can look at it tomorrow. If there is an application, I can myself upload the application to it, and it can tell me if there is an application for skincare, if I have a pimple, if there is an application, I can take a photo of it and it will analyze it. Stuff like this, it will help the personal healthcare. That for me, I don't have to go to a hospital every time. Either I go to primary care or triaging at the house.
Great. So bringing healthcare in your pocket basically is what you're suggesting. If we can get there, then you take a lot of pressure off the primary healthcare system. Okay, so we are at the wrapping up stage. I want to ask each one of you, please, what would your advice be to anyone who is looking to innovate or become an entrepreneur in healthcare, and particularly using AI technologies? So can I start with yourself, Abdul Hakeem, if that's okay, please?
Yeah, sure. So I would say the field is just starting. There are a lot of great innovation all over the world. And we can replicate a lot of this innovation here in Saudi Arabia. and make something unique for the country, leveraging the unique ecosystem that we have in the country. So I would say my word would be dream big and start small.
Thank you, much appreciated. And Abdul Qadir, if I may ask you the same question, please.
Sure. Well, I'll make it very specific. I think one of the underserved part of the health and the well-being is the mental health. AI is a potential breakthrough technology that will solve such a problem, that being estimated to a market size with 6 trillion by 2030. Knowing the fact that we are anticipating that every one of us will go through a mental health issue at least once a year. So I would advise anyone would be interested to touch base and invest in an entrepreneurship to touch and understand more about how AI and mental health as correlated, and how the AI would be a big a game changer on that domain.
Great, thank you for that, much appreciated. And Abdur Rahman, if I can please turn towards you as well.
Sure. What I'm suggesting is find your edge, the something that other people doesn't have. If I have an application for telemedicine and other people have the same, people will say they already have the first mover advantage, the other applications. What's going to be my edge if I include AI for let's say for triaging, or Dr. Abdul Qadir said that if I use it for mental health, and also to talk or to understand, is this person is, let's say, suicidal? If I ask him certain question and the AI will understand this person is having a severe mental breakdown because of, as Dr. Abdul Hakeem said, that everybody will have it at least one a year. I think during COVID-19, the past year, a lot of people, even doctors, had a lot of mental breakdown because they couldn't help. So find your edge, find something that will make other people pop, that this is the application. A small example, there is an application called Clubhouse. Clubhouse came and it took out the whole social media overnight. And after that, it went. Now it's coming back to a normal stage. But because it had an edge that people are waiting for, instead of texting or writing, I need to have a voice like this is Skype. But instead of having the audio, the video, it's just an audio that I will know how many people are there. I can moderate. I can ask questions, something like that. This is the edge they found. For entrepreneurs, find something that you will excel at. Not just healthcare plus something. After that, you will be, we hope you will succeed and you will become the next unicorn in the country.
Bahar, if I can turn to you as one thing first to check from a time perspective, do we have still some time or should we be winding down? That's the first question. I don't want to close early if we have more time. And second is, again, the same thing. What would be your advice to startups or potential innovators?
We do have a bit of time, so it depends on our panelists. So my advice for entrepreneurs, especially in Saudi Arabia, dream big, start small, have a clear business model in place, know your expectation, what do you need from the market, and what do you need from every stakeholder. Sometimes once you start working on your program or project or even startup, you get distracted by things left and right. So once you have a clear business model, and if you test your idea at an early stage, it will help you to define where is the market. So start small, find your product fit. Once you find your product fit, start working on your market fit. Don't look for investment when you have an idea. Look for investment when you have revenue in place. So be realistic, start correctly, always ask for advice. The idea is, it's not about the idea, it's about you implementing this idea in the right path, or you taking this idea into an action or milestones or steps. So have a clear idea and have a roadmap towards that.
Great. So as we have a bit more time still, do please let me know when we need to wind down. But I'm going to use this opportunity for around the house, looking at COVID. What's the one thing that you feel each one of you, please, and we can start with Abdul Hakeem yourself, that COVID is a lesson that you feel the biggest lesson you have personally learned on a personal level, and maybe on an organizational level. What's the biggest lesson you have learned?
I think the lesson that I have learned personally is that we have not been using technology in an efficient way. So I think that we've had technology, but we have not realized how much potential we can have with this technology. And a lot of things today I do them through technology, and one of them is e-commerce, for example. I used to view e-commerce as something I use when I don't find something let's say in store. But now I think I look at it the other way around. So it is vital part of my life today. On an organization level, I would assume it's the same thing. Also, a lot of things today, technology has or this pandemic has accelerated a lot of our technology use, whether it's, let's say, in video conferencing, for example. I don't need to go to another entity to conduct a meeting, but I can just do it from my office, enabling me to have more meetings. And also, let's say, when it comes to healthcare specifically, for example, a lot of things I believe on organization levels are understood that healthcare, a lot of healthcare can actually be provided through telemedicine, for example, and I think that's a vital lesson for us all.
Great. I mean, a real light bulb moment, right? So COVID has been a real light bulb moment for all of us. And we've been kind of saying to us, why didn't we do this before? Like, seriously, like we didn't realize we could do this. And one of them is obviously communicating and collaborating with people across different boundaries. We felt everything happened in the physical space, but this has taught us that you can connect and collaborate across boundaries. And the other thing for me personally is, frankly, the biggest lesson I have taken away from this is that we as governments around the world, or countries around the world, we are not ready for crisis. I mean, okay, we have looked at COVID and we have figured out how to manage, and even that, we have not got to an optimal level of managing the whole crisis of a pandemic. But that tells that as a fundamental capability is missing in countries to manage crisis, whether it's a pandemic or floods or something else. So that's the biggest thing, I think, and I'm keep on telling countries now, please think about proper crisis management. Abdul Qadir, to you, please. Same question.
Sure. So aside how COVID accelerated the digital and the virtual and how we start doing things, and I think there is the positive side where the collaborations, I think where many countries where we invented the open innovation in reality, many countries collaborate to come up with a vaccine, and that's where we see the potential value of collaboration, and do not underestimate the value of open innovation, where you can collaborate with each other to come up with the right solution in the right time. Also, it's accelerate the way we think of many different industry. As you said, we've been looking at the digital and the digital transformation for a while, but I think the future is today can be seen in particular in the healthcare. It's the data science supported by clinicians. The amount of data today is generated from different sources, either in our lifestyle, in our behavior, in our genomics, in our day-to-day. I think this is what will change the whole industry. Yet clinician is the core principle part of it, but eventually technology and data will be the core enabler for that.
Thank you, Abdul Qadir, much appreciated. And Abdur Rehman, if I can please turn to you for the same question.
Sure. From personal point of view, when COVID hit, if the countries or other health organizations share data in the beginning, we don't have this pandemic, everybody will be happy and the disease will be contained. Even right now, I mean, 2 hours ago or 1 hour ago, the White House is studying to waive the intellectual property for creating the vaccine for COVID so every other country can get those vaccine and also work if it moves, because they know that we, as either health organizations or manufacturer, they're not ready to distribute hundreds of millions of vaccine at the same time. It will take years. A lot of people are saying that by 2024, the aviation and the hospitality industry will come back. So this is after 3 years from now, because of even small thing is as a vaccination. How about if you want to manage the people? We're not ready for the next pandemic unless if you use technology right, if you mine the data and you make sure that all of the information that you will have is correct, and accountability on each health organization. If they did not say that this is a disease or a disaster that's waiting to happen, they have to prove. In the beginning of COVID, the WHO said it's not a pandemic. After 1 month from that, they said, no, this is a pandemic. So it went everywhere.
Yeah,
So
absolutely.
From our point of view, is sharing the data is the most important thing. We're not looking for blame. Who should I blame for this or blame for that? We just want to share data to make sure, how can I help my countries? How can I help the whole world for preventing the next pandemic, or even eradicate some of the diseases? If I just share the data between organization, and Dr. Abdul Qadir said that most of the countries right now, they're doing the open innovation, trying to help the other industries.
Perfect. And that's a really perfect one to end with. If we were to think beyond just the silos we operate in and looked at connecting between, especially country to country connectivity, as you said, the biggest challenge we had was having information, and that required cross-border collaboration between different countries around passengers, where they're coming, and what their status was from a health perspective. Even today, every country has created their own applications for track and trace, right? And that itself, when you look at it from a user perspective, you can start to see it wasn't really the right answer. The right answer is having some kind of global interoperability between different countries, so that if you are coming from one country, there is a connecting point between the application used there and coming to your country, so the user doesn't have to download 3 or 4 or 5 different applications for tracking purposes. I'll pause at that. Thank you so much. It's really been great. Your contributions really insightful and very informative, I'm sure, for all of the people listening. I'll hand over to you, Bahar, with just saying this, that look, if we are driven by a purpose and want to make a difference in this world, we are most likely to contribute towards that beyond our own personal self. So what you're doing with this initiative is really great, and we are there to support as much as possible. And thank you for all panelists to support us with this today. Hopefully your audience would have taken something away and maybe sparked some interest for the innovators of tomorrow. Over to you, Bahar, to bring us to a close. Thank you very much.
Thank you, Mr. Mohammad Sear, for being an amazing moderator for this panel. And we thank all the panelists that with us today, representing Sadaya and Saudi Health Council. I would just like to recap some of the main elements you guys have discussed today. A collaboration across different sectors that we see from the government perspective, initiative to boost innovation, market size when it comes, and market share when it comes to big data and AI, innovative business model and how they can tackle that, health, leveraging and using AI and data, while also looking at shared platform in place, Sadaya's role in data exchange and potential in the future, easy steps for early stage entrepreneurs to start with their ideas, opportunity when it comes to health tech. So thank you all for being part of this initiative and discussing this opportunity and shedding the lights towards that. Thank you all.
Have a great day. Thank you.
Thank you.
Thank you.